I'm Dr. Batul Dolby. I'm an educational psychologist and I'm the principal educational psychologist of CF Psychology.
My name is Dr. Reena Vahura. I am a chartered clinical psychologist.
It depends really on the specific set of circumstances of that child or young person. It depends on the specific school that they're in, their family circumstances, their personality, their relationships within their families, their relationships to their teachers in their school. All of those things have influenced what the impact has been on the child or young person. We have had adults who have shared very difficult situations, and in those cases, we've sought really to link them back into support agencies and wellbeing hubs that are provided by their university, because there is help out there. But one of the things about being very depressed or feeling very anxious is that you lose touch with the resources around you that could actually help you.
I think, one of the other big things that I'm seeing are the effects of isolation. So a lot of people have either been on their own or with a handful of people through lockdown. For some, that's put strain on relationships. For some people, being on their own, that's meant difficulties associated with being isolated. We know that as humans, we like to be connected to others, and we've not been able to do that in the same way. And I know that as restrictions are easing and people are going back into the gym and being more socially active, lots of my clients have been talking about worrying about body image and being around others again, and also, I guess, thinking about weight. One of the things I've been really aware of are lots of unhelpful posts on social media trying to advocate low-calorie diets and realistic fitness plans. So I think this is a time to be compassionate and cut ourselves some slack for the journey that we've all been on in lockdown.
Heightened parental anxieties around their child's learning, noticing things that they hadn't noticed before, becoming very concerned that their child was much further behind than they thought that they were. But that could sometimes be because the child was very far behind, but it could also be about parents. I mean, as a parent, you're not a teacher, you don't have a formal knowledge of child development. So sometimes it could just be about a parent's expectations about what a child age 7 or 8 should be able to do. So that was something I think that came up a lot for us in the practice, was many parents phoning up very anxious about their child's attainment. As with any sort of service that's being offered, different things work for different people, and remote assessments are, another option of something that can be provided for service users. For many, it has become a very popular option, because obviously it means that a service user doesn't need to travel. Our offices are located in central London, and up until the advent of remote assessments, it's meant really that we've only been able to provide our service to people who lived in that geographical location or schools who were within that area. So this now means being able to use remote assessments means that we can work with people from all over Britain, all over the world. So it's been very popular for those who would have had to travel otherwise a long way to get to us. Also for clients who may be experiencing anxiety, who experience anxiety about new situations, being able to carry out an assessment in the comfort of their own homes or in a familiar setting like their school, for example, is preferable.
I'm supervising a project that we started right at the start of lockdown with people over 80. And at that point, so this was a year ago when we started recruiting, we assumed that people perhaps didn't want to use Zoom. So we've done all our interviews over telephone. But actually towards the end, so coming into the third lockdown, people were actually asking to use Zoom. But I've actually been really impressed with how clients and patients have really adapted to working online. I think working remotely has offered a range of possibilities, both in the NHS and privately. So using things like Teams and Zoom and video calls has meant that maybe we're able to work a bit more flexibly and see people at different times. It means that people don't have to travel, which can be of benefit in lots of ways.
When we're deciding what kind of option is best for a service user, we need to consider factors like digital poverty and also things like how good the service user's IT tech skills are, because when you're delivering a remote assessment, you have to work obviously they're at their end with their equipment, and you have to be able to work with them to ensure that the environment is conducive to performing the tests accurately. There's also other factors that you would need to consider as well, such as the age of the client that you're working with. It's obviously not suitable for younger children. So that sort of triaging process or scoping process at the beginning of a piece of work is very important to make sure that you get the right option for the client. The reasons why I am so passionate about it is, I mean, there's many reasons. Firstly, the efficiency savings that technology brings, the accessibility, the way that it makes our assessments and the service that we provide so accessible to our clients from, all over the UK and also internationally. And another thing is also the increased accuracy that is afforded by practicing using digital platforms. For example, using Q Interactive pretty much eliminates or massively reduces administration and scoring errors, which are a big issue really in psychology assessments. So it really improves the accuracy and the validity of the assessments that we do, and also reduces certainly the in-house formulation and practice support systems that we use really reduces bias. There can be no doubt about it, digital solutions and digital tools are here to stay. They are the way forward. And I think that is prevalent really across all professional sectors. Digital skills, tech skills, and that's in terms of being able to use digital platforms to administer and to score, like Q Interactive, to be able to administer remotely, but also being able to use things like video conferencing for other professional activities like consultation meetings, supervision meetings, training. So really equipping the next generation of psychologists with those digital skills would be immensely helpful for us.
I think that services were beginning to think about how to use digital technologies a lot more. There's been work I know that's been done by NICE, and I know that professional bodies have been considering it. But I think the pandemic has really forced us to think more creatively about how we use technology and when we use it. So I think there have obviously been lots of really difficult things that COVID has brought, but I think it has encouraged us to think about the way that we offer services.
The fact that our clients and practitioners no longer need to travel to carry out our work is obviously better for the environment, and that has got to be a good thing. And this has really opened up opportunities for us to be able to bring sort of inclusive models of education internationally to schools in all different parts of the world. So that has been a really exciting and positive thing.
I think now as services, we're thinking more around having a blended approach. So actually, which are the bits of working remotely, which bits have worked well and what would we like to stick with? But then also, are there advantages of seeing people face to face, and have there been things that we haven't been able to do online that would be better to do? So I think it's more around having that blended approach. For myself in private practice, I think I'm going to keep the majority of my work online because of the flexibility that it has offered, and it seems to be working well with the clients that I'm working with at the moment. So I really think it's going to vary for different client groups and different services. And I think it might also be assessing where some of the difficulties have come up. So again, there are certain sessions where I might be doing practical exercises with people, and in that case, it's not always felt very helpful to be delivering online.